The Public Health Risk Communication Group is advocating the building of resilient communication and community engagement in response to future pandemics. Through African countries continue to be plagued with these pandemics, the necessary response measures are yet to be fully built. Chairman of the group, Dr. Da Costa Abuaje, says there is a need for the necessary budget to be channeled towards the area for improved response to the pandemic. He spoke at a side event of the 3rd Annual International Conference on Public Health in Africa held in Lusaka, Zambia. Nanaya Ojima has more on this report.
Though risk communication and community engagement remain important in public health emergencies, it has received little attention. Most countries have focused on surveillance, laboratory systems, logistics and case management to the neglect of deliberate involvement of the community. Chairman of the Public Health Risk Communication and Community Engagement of Practice for Africa, Dr. Da Costa Abuaje, bemoaned the reliance on development partners for financial support. He wants a paradigm shift in preparation for future pandemics.
Today's realities in our various countries are that the risk communication has not been given full attention. Priority. Financial commitments are not matched to the community engagement interventions that touches and transform the behaviors of our community and individuals. This side event of the 3rd International Conference on Public Health in Africa under the theme Strengthening the Continental Risk Communication and Community Engagement and Social Behavior Architecture, preparing communities for the next pandemic presents a paradigm shift to chart a new path by giving priorities and financial resource allocations to the risk communication and community engagement pillar in public health emergencies. Currently, most countries in Africa do not have the risk communication national budgets allocations and depend solely on development partners. This cannot continue as we want to build Africa report.
Vaccine hesitancy and low adherence are among challenges militating against the fight of pandemics in Africa. Dr. Abuaje outlines effective solution to the challenge.
Early community engagement is critical to ensuring community ownership for public health interventions during disease outbreak. Therefore, strategies as well as financial resources for emergency response must be decentralized and extended to cover risk communication activities. Further, during the Kampala gathering, countries presented their unique risk communication experience whilst responding to multiple outbreaks, and key among the challenges highlighted were low adherence to preventive measures, vaccine hesitancy. As you heard this morning, most of the conversation actually ended with what? Risk communication.
The Public Health Risk Communication and Community Engagement Community of Practice for Africa was established by the Africa Center for Disease Control and Community Engagement and the World Health Organization Office for Africa. It is expected to promote best practices and offer a learning platform for effective public health risk communication and community engagement. For JoyNews, Nanaya Ojima reporting.